All right, I think we're rolling. Hey, good morning, everybody. This is Dr. Green. I have wanted to start doing some Instagram videos, start a YouTube channel. Um, I'll get into why later, but wanted to do a little bit of the life of a clinical pathologist, a day in the life video. Today, I'm on a coagulation rotation, which has been a bit of a hybrid research month with clinical aspects. I worked in lately. I've been working on a couple case reports at home, setting up some future research that I'm going to be doing over the next couple of months. I also do some clinical work, mostly triaging laboratories. Get a call to check the indications for things like mixing study or hit antibody assays, um, see if we need to send out for more advanced testing. So I get a little bit of that throughout the day. Right now, I'm just setting up for the morning. It's almost going on 9 o'clock. I've been working on the abstract for a paper for a little while, and now I'm about to log on to team rounds. The transfusion medicine rounds go on every morning at 9 o'clock. We've been doing them on Zoom. I'm gonna log into those. It's the Tuesday after a Monday holiday, so we're gonna have the full weekend worth of cases to go over. The residents who were on call handled the cases over the weekend, and we're gonna talk about them today. Uh, See if there's anything to follow up on. See if the right decisions were made, and what else could have been done. Um, so that's the plan for now. That starts at 9 o'clock. Today it could go for an hour and a half or so because it was so busy. Other days it's a little shorter. I'll share that as they come. It could be as overnight. You know, if it was a normal Tuesday, they had call Monday night. It could be 10-15 minutes. Since it was the weekend, it's gonna be a long one, but it'll be fun. Um, and then after that, I'll get back to working on my papers. Call my attending up and see if he had any other plans for me today, and we'll go from there. I'm gonna end the video here and check back in later and then merge them all together this afternoon. All right. All right, hey everyone, I'm back. We just got done with the transfusion medicine rounds a little while ago. It wasn't too bad today. It took about an hour. We had some pretty neat cases. Had a case of hemolytic disease of the newborn. Had a sickle cell case that was acute chest syndrome. So with that, transfusion medicine's role, we end up doing red blood cell exchange on those patients with ACS. It's one of the criteria for getting an exchange transfusion. We also went through some product triages over the weekend. At our institution, we triage a lot of the platelets and plasma products. A lot of orders come in from various clinical teams, a lot of times wanting to correct INR, perceived coagulation defect, and we triage those. When the order gets from the blood bank, they'll give us a call as residents, and we call and just take a look, see if it's indicated, see if there's anything else we could help the team with. You know, maybe instead of plasma, maybe they've got low fibrinogen and cryoprecipitate might work better. So we went through some of those. We had a TTP case that we were working up. Those patients with a TTP, thrombotic thrombocytopenic purpura, they have usually an inhibitor to ADAMTS13, causes their von Willebrand factor multimers to remain ultra large. It causes thrombotic microangiopathy and several other problems depending on the patient. So these patients get plasma exchange, which we oversee. So we had a case of that. Overall, it's pretty fun. I really like transfusion medicine, and even when I'm on a coag or another rotation, I'll hop in on the rounds. So we got done with that today. I wrote up the abstract from my case report. The case report it's mostly done. It needs some editing and revisions, but the abstract was the last thing I was going to do. So I did that, sent it off to my attending for review. See if he likes it. We'll send it to the other authors. And now I just had a few minutes. I'm at home, so I'm gonna go hang out with the baby for a few minutes in between doing things, and I'll log back in and make another video later. See what else we've got going on. All right, I'm back. So I had a little bit of downtime in between finishing up the paper earlier and the next project I was going to work on. So hung out with the baby just for a little bit of time. I'm on duty hours. It's nice to be home, but try not to slack too much. So hung out with him for a few minutes for a break. I had some lunch, and then I spent some time reading a textbook. Clinical pathology is pretty great. We have a decent amount of time balanced between being able to read and study and doing our other work. So I read some surgical hemostasis for coagulation related topic. And then I actually started on a new project we're going to be doing, creating a database for some of our patients to be able to start looking into some things, outcomes, treatment plans. I just got a hold of it. It looks pretty cool, so I'm pretty excited about it. It's going to be a lot of chart review, but it'll be worth it. It'll be a good project, and hopefully some good papers come out of it. So that's what I did this afternoon. A little bit of reading, a little bit of work, ate some lunch. It was a pretty good day. Gonna get on the call with the boss here in a little bit. He reviewed the paper. Gonna go over some of the edits, and then tomorrow I'll be back at work. We've got a resident lunch, so we're finally meeting in person again after the COVID stipulations calm down. Gonna meet up in a large room and be spread out, but at least we'll get to see each other. Yeah, for a while there, I hadn't been able to meet most of the residents, but by now, starting to meet everybody, and tomorrow will be a day in the office, so that'll be good to be back. But all right, so I'll sign off for now. I'm gonna try to put these videos together. First one, so there'll probably be about 2 people watching this in the next couple of months, but who knows, maybe I'll blow up at some point, and everybody can come back and laugh at how simple my videos were and this goofy lighting I've got going on.